Okay, I'm Samuel Lee, here today talking to Dr. Lederman about radiosurgery treatment for cancer.
Thank you for having me.
What is radiosurgery, doctor?
Radiosurgery is really a revolutionary new method of treatment for cancer. Often people who have cancer have had in the past, and even to this day, radical surgery, where doctors try to remove the cancer, physically remove it through surgery. That's one method of treatment. Another method of treatment is using chemicals like chemotherapy. Those chemicals that poison the cancer can also poison the body, causing side effects.
Wow.
And so many people who have chemotherapy have side effects, number one, and often the chemotherapy stops working. Standard radiation radiates large areas of the body to get to the cancer. That's what most people who have radiation in this day and age have. Standard radiation, large areas where a small proportion of the radiation hits the cancer and a large proportion of the radiation hits healthy tissue. That's called collateral damage. Radiosurgery is just the opposite of all those treatments. Radiosurgery is not surgery. There's no cutting. There's no bleeding. It's only invisible beams from thousands of angles that are all focused on the cancer. So it's different than chemotherapy because chemotherapy goes throughout the body. Radiosurgery goes to the cancer. By going to the cancer, we can get higher doses and more effective treatment. Surgery is a mechanical removal. Patients have to go through surgery and all the complications of surgery, which are often tremendous. And some people can't even tolerate any surgery. And then there's the standard radiation. So our treatment is totally different, really, than all those usual treatments for people with cancer.
So, how is radiosurgery different from other cancer treatments?
Well, it's different from surgery because surgery is mechanical removal of part of your body. If you have, for example, prostate cancer and you have surgery, removing the prostate for a man means that most likely his sexual function will be damaged, his urinary function will be damaged, and often this treatment fails. For a woman with breast cancer, removing the breast is something many women do not want to do. Removing the lung means having less respiratory capacity. And operating on other parts of the body can be very difficult for the patient to overcome and recover. Compared to standard radiation, we're talking about less treatments with radiosurgery, more focused treatments, and higher success rates. For example, with lung cancer, standard radiation has a success rate of about 50% with 6 weeks of treatment. With us, in just a few treatments, our success rate's 90%. So it's very different than the usual treatments available for most people in the world.
Understanding how successful you are, doctor, why are you the first in the Western Hemisphere with stereotactic body radiosurgery?
It's really a long story why we're the first facility. I'm the first doctor performing radiosurgery. But it has to do with, number one, my training. I am triple board certified, so I have more background than most doctors. I was involved with the forefront of radiosurgery in its developmental stage, and I understood that if you could treat the cancer without hurting healthy tissues, it would be ideal for the patient. What's more ideal than an invisible beam, non-invasive, outpatient, high success rate with few or no side effects?
Wow. So understanding one other topic with what is brain radiosurgery?
Brain radiosurgery is where radiosurgery first began. And brain radiosurgery is the easiest because we have the skull. The skull is a basis. The skull holds the brain, and the skull is rigid. So the original radiosurgery had frames that attached to the head, and then from those frames, beams would send in for thousands of angles to hit the tumor. We were the first in New York with brain radiosurgery. We're the first with fractionated brain radiosurgery. Fractionated brain radiosurgery means we divide up the dose non-invasively with none of the screws that other places commonly use.
Oh. What are the results of radiosurgery?
Overall, of the thousands of patients, and we've treated about 40,000 patients with radiosurgery, overall our success rate where we aim the beam is about 90%. That means 90% of the time the cancer will stop or shrink or go away for the life of the patient where we aim the beam.
How do you define success with radiosurgery?
Success means that that cancer that we treat never needs any further attention. If we treat, for example, a person with pancreas cancer in the pancreas, most likely more than 90% chance that that cancer in the pancreas will stop or shrink or go away, and that's true anywhere in the body. Lung cancers, breast cancers, colorectal cancers, bladder, prostate, you name it.
What types of cancers are treated with radiosurgery?
Really, most any kind of cancer that we can see and that we can target. So we treat many, many cancers in the brain. There's two kinds of cancers in the brain: cancers that start in the brain, primary cancers of the brain, or cancers that travel to the brain. Then in the body, outside the brain, we treat cancers of the head and neck area, the tongue, the mouth, the throat, the voice box, for people who don't want to go through radical surgery. Some patients come to us and they've had prior treatment earlier, and the prior treatment, chemo, radiation, or surgery didn't work, and they're looking for a second chance. And we treat many patients as a second chance as well. Other cancers, anywhere in the body that you can think of, lung, pancreas, liver, lymph node, bone, prostate, bladder, gynecologic sites, colorectal sites, most sites, and more.
Which seems like any part of the body thing.
Not any part. There are certain cancers that we don't treat. We don't treat, in general, leukemias or cancers of the bloodstream, but we treat solid cancers, and those are the dominant cancers in this world. We treat dominant cancers most anywhere in the body with high success rates, non-invasively.
So how is radiosurgery performed?
So radiosurgery means, the name is really stereotactic radiosurgery, and to do stereotactic radiosurgery, there needs to be a frame outside the patient. And a simple picture of this is illustrated in our booklet, which I'm happy to provide you and all your friends. But we make a stereotactic frame around the patient. This holds the patient in fairly rigid position, but allows us to, number one, computerize the body, find the cancer in relationship to the body and in relationship to the stereotactic frame. And then from thousands of angles, we send in invisible beams of pinpoint radiation to attack the cancer.
What does the patient feel during radiosurgery?
Most commonly, patients feel nothing. They're invisible beams that attack the cancer. So most people have no side effects. A few people, when we treat very large cancers or cancers around the intestines, might have some nausea. When that's going to be possibly happening, we often give pre-medication for that. But for most people, more than 90%, people feel nothing. It's totally different than surgery or standard radiation or chemotherapy.
So how long is a typical treatment period, of radiosurgery?
Typical treatment takes about 10 minutes. People come in here, they walk in, get a treatment, and walk out.
Okay, and how does radiosurgery compare to surgery for cancer treatment?
Well, it's totally different. Surgery means a mechanical removal of part of the body. For example, if you have a lung cancer and you remove part of the lung, that person will never have that lung to use to breathe again. That person will have lost that part of the lung. And I see people who have lung cancer, they've had surgery, and they've lost their capacity. They can't climb upstairs, they can't walk like they used to walk because they've lost their respiratory capacity. Our patients, for example, lung cancer, we zoom in and hit the cancer in general without hurting the healthy lung. So the patient keeps their lung, avoids surgery, and has a high or higher success rate than with surgery.
It's very promising. Now, how does radiosurgery compare to standard radiation for cancer treatment?
Standard radiation will often radiate large areas of the healthy body to get to the cancer. We're just the opposite. We send all the beams in to attack the cancer without all the collateral damage. Here, for example, in yellow is the collateral damage, healthy tissues being radiated, whereas here you can see radiosurgery, pinpoint treatment focused on the cancer. Now, pinpoint means different things to different people. If a patient has a tumor that's the size of a ping pong ball, it's not pinpoint, but it's a size to treat that entire tumor. We treat the entire cancer. Everything that we can see is treated.
So how does radiosurgery compare to chemotherapy for cancer treatment?
Another good question. Chemotherapy you can see illustrated here. In red is a picture of a human being. The chemotherapy is red, and you can see the entire body is red. Why is that? Because the chemo is going throughout the entire body, from the head to the toes and everywhere in between. Chemotherapy tries to poison the cancer more than it poisons the body. But remember, the whole body is being filled with chemotherapy, and that's why there's so many side effects.
Wow. So how long have you been performing radiosurgery, doctor?
We've been performing radiosurgery for 30 years.
Oh, it's quite a long time.
Long time.
So what is the best way to learn about one's cancer treatment options?
The best way is really to come for consultation, to meet and discuss all the issues. I like to sit down with patients. I like to get a full history. I like to examine the patient. I like to go through the medical records and then talk about all the options. Many doctors, it seems, just like to talk about what they do. The surgeons seem to like to talk mainly about surgery, and the chemo doctors talk about chemo. And I don't think it's really fair to the patient not to have a chance to learn about all the options. So when patients come here, I talk about all the options, whether it's chemo, surgery, radiation, standard radiation, radiosurgery, combination treatment, or even no treatment.
Well, and I have this question for you, doctor. Why don't all doctors tell their patient about radiosurgery cancer treatment?
Well, I think if a surgeon was seeing, let's say, a woman who had lung cancer, and that surgeon was a lung cancer surgeon, if he told the person, okay, you come in the hospital, we're going to cut out your lung, you'll never have that lung again, you'll never be able to breathe the same, you're going to be left with a chest tube, you're going to be left in pain, you're going to be left with IVs, you can have bleeding or infection, you're going to maybe after a week go home and then take weeks or months to convalesce, you may never be the same. Or if you want, instead you can go see Dr. Lederman, lay down on a table, get an invisible beam, and then go across the street to go shopping 10 minutes later. Most of his patients would probably leave him. So it's, I believe, the interest of the surgeon, sad to say, is not the same interest as the interest of the patient. So I try to fight for the interest of the patient. I believe that we have, in general, an excellent modality of treatment. It's not perfect for everybody, and I'm the first one to say it, but it's very good treatment for many people, and many people never get to learn about it because their doctors often do not tell them all the options available.
Unbelievable. Were other doctors then angry or jealous when you brought first in America, for radiosurgery for cancer patients?
Well, there's tremendous anger and jealousy even to this day. For example, I have a patient right now who came to me with a kidney cancer. Actually, they came with a prostate cancer. They came with a prostate cancer. We got a scan of their abdomen to make sure the cancer hadn't traveled. They have now a mass in the kidney. They have two separate cancers, the prostate and the kidney mass, which is most likely cancer. This patient saw a urologist. A urologist is a surgeon who operates on the urinary system. The surgeon told the patient they have to have surgery. They have to remove that kidney. And meanwhile, I'm telling the patient that you can have surgery if you want, but you can also have non-invasive treatment, radiosurgery, have a high success rate, 90% or higher, keep your kidney, have no cutting, no bleeding, no surgery. Do you think that surgeon likes me? For the last 20 or 30 years, every patient who's had kidney cancer, he's removed the kidney. And now all of a sudden, he hears about a technique where we don't need his services any longer. So it's natural. We're upsetting the apple cart. We're a disruptor. As I say, in industry or finances, there's disrupting technology, like when cell phones came into power. Radiosurgery is a disruptor, and it disrupts the medical system. And no one likes disruption except for the person who's doing the disruption.
Understood. What is the best way that you can be contacted?
You can call. We have a phone number. We have email. You can come in. So there's so many ways you can contact me nowadays.
Do you have other information available concerning radiosurgery for cancer treatment?
We have plenty of information. I brought some of the information with me today. We have a new booklet about the history of radiosurgery, the first doctor in the Western Hemisphere performing radiosurgery, and the story behind it. So there's more information than what we talked about. This is a booklet about body radiosurgery, stereotactic body radiosurgery, and our work and examples. And in the book is not only how we do it, but also examples of patients who've been treated before and after, so you can actually see the work we do. We have illustrations available so you can understand all the options available for a patient with cancer, whether it's surgery, radiation, chemo, combination, hospice, no treatment, or our method of treatment. We have the art of radiosurgery and why get a second opinion. A lot of the art illustrates the important points that we've discussed today. And one separate booklet is just examples, dozens of examples of patients who've gone through radiosurgery before and after, from the head to the toes, literally. And we treat many skin cancers. I didn't talk much about skin cancers, but there's hundreds of thousands of skin cancers a year in a country like America. And many people do not want deforming surgery on their skin. I've seen people lose their nose, their ears, their mouth, vital structures because of skin cancer, and the patient was never told about non-invasive treatment.
Can you treat small or large cancers?
Yes, and in the book you'll see examples of tiny little cancers we treat, the size of almost like smaller than a grain of rice to the size of almost a soccer ball. And you'll see examples of that.
Well, can you treat cancers most anywhere in the body then?
Most anywhere in the body.
That's very good. Then can you treat cancers even if chemotherapy, surgery, or radiation was used and was unsuccessful?
Yes, we treat many cancers when chemo, radiation, or surgery was not useful or not tolerated or not wanted. There's many people who don't want deforming surgery. There's many people who don't want chemotherapy. There's many people who don't want weeks and weeks of standard radiation. So many reasons people come here.
Okay. What do you do about a woman who has breast cancer and does not want to lose her breast and does not want to have surgery or chemotherapy?
Well, I'm glad you asked that question. And actually in our body booklet, the body radiosurgery booklet, you'll see examples of women who've gone through our treatment. These are examples and actual pictures. There's CAT scans and pictures of women's breasts where there's been no surgery. There's been no lumpectomy, no mastectomy. Lumpectomy is removing the lump of cancer. Mastectomy is removing the breast. And no chemotherapy. So there's women that we've treated, and we've treated many now, with high success rates. So the woman keeps her breast, avoids the surgery, avoids chemo. This is for women who want a different kind of treatment.
And what do you do about a patient who has cancer and cannot undergo usual surgery or chemotherapy?
Well, they might consider our treatment.
There are many diseases that we're not talking about today. If a patient has one of the other diseases, how do they get more information, doctor?
Well, I'm a cancer doctor, so some people come to me with all kinds of medical problems. I'm a cancer doctor, and we specialize in treating people with cancer. So if you have a cancer or suspected cancer, there's basically three types of people who come to us. People who have known cancer, newly diagnosed, and they want to hear about all the options first. There's a second group of people who have cancer. They've gone through chemo and radiation and surgery. It hasn't worked, and they want fresh options. And then some people come to us when they think they have a cancer. They have a mass in the breast, or they have a high PSA, or a nodule in the lung, or the pancreas, or the liver, and they want to come here for their medical care.
Can patients correspond with you directly?
Yeah, sure. You can email, you can call, but again, the best way is to meet in person.
You will send them information as well?
Yes, if you send your name and address and phone number, you can call us. Our phone number is in the United States, 212-CHOICES. 212 means New York City, and choices means that we believe most people with cancer have choices. So 212-CHOICES in digits, that number is 212-246-4237. You can call, leave your name, address. We'll send you a booklet out at no charge. And you can tell us what's your interest, whether it's about brain tumors, prostate cancers, or other cancers. We'll send out a package and DVD.
I have one more question for you, doctor. How do you follow up patients who have been treated?
We follow everyone for the rest of their life. So many people ask that. They say, oh, you just treat and run away? No. We treat patients and then follow them with scans and reports and physical exams and blood tests, so the patient really knows what's happened to their cancer.
Well, that's all the questions I have for you, doctor. Thank you very much.
Thank you. God bless you.
Thank you.